Welcome to Module 17. In this section of the course, we're going to focus on basic first aid situations that we might encounter in behavioral health or community-based settings. And we are not medical providers, but emergencies and injuries can still happen during group sessions or office visits or community programs, residential settings, transportation situations, whatever. And the clients are going to get cuts, they're going to get burns, they're going to fall, they're going to have nosebleeds, minor injuries, choking, whatever. Maybe it's a sudden medical concern, while they're participating in services. So this module is designed to provide practical awareness and basic response principles when we are providing services. And I also want to emphasize safety and professionalism and staying within your scope of practice. The goal is not advanced medical treatment here. We just want to help you to remain calm, respond appropriately, reduce panic, maintain safety, and also recognize when additional medical assistance might be needed. And so one important thing to remember is that in first aid in the behavioral health settings it's going to involve balancing both physical safety and emotional safety. Our clients are going to feel embarrassed or maybe even frightened, emotionally overwhelmed or ashamed during medical situations. So we need to remain calm and professional, and that significantly reduces the distress while helping to maintain that safe environment. So the first priority in any first aid situation is we want to just remain calm. Panic increases the confusion and it makes the situations harder to manage effectively. So before we can help someone, we need to quickly assess whether is this environment safe for me to enter in? What happened? Is the person responsive? Is more medical assistance needed than what I can provide? And I need to protect myself appropriately. So I need to glove up, when there's blood or bodily fluids present. I need to make sure that I can approach carefully if it's an unsafe environment. If there's a growling dog, I might not want to approach, right? Sometimes we feel this pressure to immediately fix situations, but effective first aid starts with observation and communication and maintaining your own safety as well as client safety. We want to stay emotionally steady, and that's going to help the injured person and others nearby to remain calmer. You don't need to know every medical answer here in order to respond professionally and appropriately in these situations. So let's talk about minor cuts and also bleeding. These are really common first aid situations that we might encounter. For a small cut or a scrape, use gloves if you're going to be the one touching. If you can't just hand someone a Band-Aid, use gloves. Gentle pressure to help stop the bleeding. You might clean the wound according to any workplace procedures, but avoid direct blood contact whenever possible. Don't touch people's blood. Most minor bleeding can be controlled relatively quickly with calm basic care, but you should pay attention to any signs that bleeding may be a little bit more serious, like heavy bleeding, or if it's bleeding soaking through materials very quickly, if the client is becoming dizzy or losing consciousness, or you have an inability to stop the bleeding. Severe bleeding may require emergency medical assistance. Clients experiencing injuries may also become emotionally distressed or embarrassed, especially in group settings. So professionalism is going to include maintaining calm and just protecting the client's dignity while addressing the safety concerns. Burns might happen in behavioral health settings through hot liquids, cigarettes, cooking accidents, environmental exposures. So for minor burns, we just want to run it under cool water, not cold water, but cool water. That's to help reduce the heat and the discomfort. Ice, generally not applied directly to burns because it increases tissue damage. So steer clear of the ice. Just run it under some cool water. Don't apply unapproved substances. Don't try to break any blisters. Don't attempt any advanced burn treatment beyond your training. The signs that the burns may require medical attention are going to be larger burn areas, burns involving the face or the airway, any burns that are like severe pain, any blistering or signs of infection. And our role here is just basic support and safety and appropriate referral. We're not advanced medical care. Okay. Bug bites and bee stings, these are usually minor, but the counselors still need to understand when these situations may become medically serious. Common symptoms of minor bites and stings might be redness, itching, mild swelling, temporary discomfort at the site. For most mild reactions, basic first aid may involve cleaning the area, applying a cool compress, monitoring any symptoms. But some people may experience allergic reactions that become dangerous pretty quickly. And so we want to watch out for any symptoms of like difficulty breathing, swelling of the face, the lips, the tongue, the throat, dizziness, rapid worsening of any symptoms. You see widespread hives or maybe even a loss of consciousness. And these symptoms are going to indicate a severe allergic reaction called anaphylaxis, which is a medical emergency. Now, emergency medical services need to be contacted immediately if there is a severe allergic symptom that happens. And we need to remain calm. We don't want to minimize the symptoms, especially if the breathing problems are present. You know, maybe the person carries emergency medications like epinephrine auto injectors for severe allergies that they already know that they have. And so we need to follow workplace procedures and remain within our level of training here and authorization regarding emergency medication assistance. You know, our role here is recognizing the warning signs, maintaining safety, contacting the emergency services when needed, and providing calm support until medical help arrives. Any client that's experiencing an allergic reaction may become frightened very quickly, particularly if breathing feels difficult. So just calm reassurance and prompt action are both important during these situations. Heat exhaustion is another one, and dehydration. These are common medical concerns that we might come across, especially in hot climates or other vulnerable populations. And people can become dehydrated because of heat exposure or vomiting, diarrhea, stimulant use, alcohol use, poor nutrition, excessive sweating. Maybe they have a limited access to water. And so the symptoms that we're going to see here are being thirsty, having a dry mouth, headache, weakness, dizziness, sweating, muscle cramps, fatigue, whatever. And as dehydration or heat illness worsens, people may develop confusion, rapid heart rate, vomiting, difficulty walking, fainting, or an altered consciousness. And substance use can increase the risk significantly because some substances affect body temperature regulation, their hydration, their judgment, and their awareness of their physical distress. And so we should encourage people experiencing mild symptoms to move to a cooler environment and to rest and hydrate if appropriate. But severe symptoms of heat exhaustion or dehydration, confusion, loss of consciousness, seizures, an inability to stay awake, and that may indicate heat stroke or severe dehydration, which are medical emergencies. And that's going to require immediate medical attention. Again, stay calm, monitor the symptoms carefully, and contact emergency services when necessary. Now, behavioral health professionals, we frequently encounter clients experiencing panic attacks or anxiety or emotional distress. And so we're going to see symptoms like rapid breathing, tightness in the chest, dizziness, sweating, shaking, numbness in the hands or feet, feelings of losing control, but they haven't been doing anything. They've probably just been sitting there. And these symptoms can feel extremely frightening to the person that's experiencing them. So we do know that medical emergencies may initially appear similar. So for example, maybe somebody's having a cardiac problem or an overdose or a diabetic emergency or a breathing difficulty, and that resembles anxiety symptoms. So we need to avoid automatically assuming that symptoms are just panic without observing them carefully. We need to ask about other factors like, are you having any chest pain? Is the client losing consciousness? Or are they severely confused? Are they having breathing problems? Are the symptoms getting worse? That might indicate a medical emergency that requires immediate evaluation. We are not trying to diagnose the exact condition, but we do need to prioritize safety and seek medical assistance when we're uncertain about what's going on. Because remaining calm, speaking reassuringly, that's going to help reduce the emotional escalation, and help them to feel supported, while you're getting help for them. And we may encounter situations involving self-harm injuries or severe emotional crisis. And this can be with clients or staff or, while other people are present. And so we got to focus on maintaining the safety of everyone, assessing what's the seriousness of the injuries, and just remain calm. Contact emergency services when appropriate, but we want to avoid any shaming reactions like, why did you do that? All right, we don't want to shame. We don't want any angry responses like, stop it right now. Emotionally escalating the situation. We don't want to do any of that. They're having an emotional crisis and they're already feeling overwhelmed and hopeless and ashamed and emotionally dysregulated. So your response should be calm, respectful, and safety focused. If the injury involves severe bleeding or loss of consciousness, if they have suicidal intent, or if there's immediate danger, emergency medical or crisis services should be contacted promptly according to whatever your workplace procedures or local laws are. You should also protect the client's dignity and their privacy as much as possible during these emotionally vulnerable moments. The goal here is safety and emotional stabilization and appropriate referral, not punishment or humiliation here. So falls can happen for a lot of different reasons. Maybe the person was intoxicated or they're having a medical condition or something. Maybe they're dizzy, they're having withdrawal symptoms, medication side effects. Maybe there's an environmental hazard like they tripped over a cord or something. But after the fall, we need to observe them carefully for a couple of warning signs, like if they're confused or vomiting or they're dizzy or they have a severe headache. Maybe they're losing consciousness or having difficulty speaking, or just any number of unusual behavior changes. If you notice any of that, we need to take it seriously. Head injuries should always be taken seriously. We need to avoid moving them unnecessarily if a serious injury is suspected, unless immediate danger is existing. Clients may insist that they are absolutely fine when the symptoms suggest medical evaluation is needed. So we need to prioritize safety over minimizing their concerns. Changes. Nosebleeds are usually minor, but they can still feel alarming for clients. A person experiencing a nosebleed should generally remain seated upright. They want to lean forward slightly and apply pressure to the soft part of the nose. Leaning forward helps to reduce the swallowing of blood. We don't want them to do that. And a lot of people were taught to tilt the head backwards. That actually increases the swallowing and the discomfort. So we need to monitor for unusually heavy bleeding, prolonged bleeding, dizziness, signs the situation may be more serious. Again, calm communication helps to reduce panic. Now, choking can become life-threatening pretty quickly if the airway becomes blocked. So if the person cannot speak, they cannot breathe, they're panicking, they're clutching the throat, they have an inability to cough effectively, like if you ask them to cough or to speak to you and they cannot, then they're probably choking. And a person who is coughing forcefully may still be moving air, which is different from complete airway obstruction. Severe choking situations require immediate emergency responses. And so we need to follow workplace procedures and only perform interventions as we are trained to do and authorized to provide. And the most important priorities are recognizing the emergency, calling for help, and remaining calm. We also need to remember the recovery position that we talked about. The recovery position is used for people who are unconscious or minimally responsive, but they're still breathing independently. So positioning someone on their side is going to help keep that airway open. It's going to reduce choking risk, and it's going to improve the safety while we wait on the emergency responders. And the recovery position is not a substitute for emergency medical care. We do need to continue monitoring breathing and responsiveness while we are waiting for help. Infection prevention remains important during all first aid situations, so we need to use gloves when exposure to blood is possible. We want to wash our hands thoroughly. We want to follow any workplace safety procedures consistently. Universal precautions are designed to reduce risk without increasing stigma or fear. Also, professional safety practices should remain consistent with all individuals rather than just based on assumptions about who may or may not have infections. That's kind of crazy to even think about the fact that we would do that. But the goal is professionalism and safety, not to panic. And even relatively minor injuries can trigger strong emotional reactions. Because clients might start to feel embarrassed or frightened or overwhelmed, or maybe they feel emotionally vulnerable during these medical situations. And that's really true in group settings or in public environments where you're like, oh my God, I cannot believe this is happening in front of everybody. And so what we need to do is remain calm, reassure them, be respectful. Do not be dramatic in your reactions. No shaming comments. Don't create unnecessary panic here. We want to protect their emotional dignity, and that's an important part of our professional care for them. Some medical emergencies may involve behavioral changes like confusion, agitation, aggression, panic, disorientation, emotional dysregulation. And these reactions happen because maybe the person's intoxicated, or they're overdosing, or they have a head injury, or they're going through withdrawal, or they're having severe anxiety, or a medical illness, or an altered mental status. And if you ask me, when I'm hungry, angry, lonely, or tired, right? Clients experiencing confusion or medical distress may not be thinking clearly, and they may react unpredictably. So we have to focus on maintaining personal safety for the client, for yourself, for protect other people nearby. Use calm communication. We're not freaking out here. We want to reduce the environmental chaos when we can. So we don't want to yell. We don't want to threaten. We don't want to use threatening language. No arguing. No physically restraining somebody unless specifically trained and authorized to do so. Escalation often increases the danger for everybody involved, so we need to seek additional support or emergency assistance when the situations become a little bit unsafe or medically unstable. Professionalism is going to include recognizing when safety requires outside intervention rather than just trying to do it by yourself. And during an emotionally charged emergency, being calm and steady and having that calm communication can really reduce panic and confusion. And we should always remain aware of our scope of practice during first aid situations, because your role may be recognizing injuries, providing basic support, maintaining safety, contacting emergency services, and then following the workplace procedures. What your role does not include is diagnosing conditions or any advanced medical treatment. We're not acting beyond our training and our competence. And professionalism includes recognizing when additional medical support is needed. So as we close this module, I want you to remember that first aid situations can happen unexpectedly in behavioral health and community settings. And we do not need to become medical experts, but we do need to understand basic first aid awareness and safety principles and infection prevention. And we also need to understand when emergency help is going to be needed. Remain calm, be professional, and be observant. And that's going to help improve the safety for both the clients and the staff. In the next module, we're going to discuss documentation, incident reports, and professional boundaries, and also counselor responsibilities following medical emergency situations in behavioral health environments. So when you're ready, proceed on to Module 18.